Well, going to the hospital can be an uneasy experience. Many patients and family worry about the illness or the tests they're facing. And there's the possibility of acquiring an infection during their stay. Medical reporter Lorie Johnson looks at the more common hospital infections and how healthcare workers, patients, and their families can possibly minimize the risk.
Armando Nahum knows what it's like for family members to become statistics after being infected in the hospital while being treated for a different reason. Sadly, he's probably seen it more than most.
3 members of my family were impacted with hospital-associated infections in 3 different hospitals, in 3 different states, in 10 months' time, culminating with the death of our son, Josh.
It began when Armando's father came down with pneumonia while being hospitalized for bypass surgery. Then, during a stay for a different surgery, his wife Victoria developed a staph infection. While they both survived, Armando says his 27-year-old son did not survive a sepsis infection contracted after being admitted and treated for skydiving injuries.
You always have a broken heart when you lose a child, but it doesn't matter how old the child is.
Armando's family isn't alone. On any given day, 1 out of every 31 patients has a healthcare-associated infection, leading to about 90,000 deaths per year. Bacterial infections make up the vast majority, which develop when bacteria enter the body through a surgical incision or due to a contaminated medical device like a catheter, central IV line, or ventilator. In addition to the damage to the patient, these illnesses cost the healthcare system billions.
If a patient acquires an infection while in the hospital, then it's the hospital that pays that, the insurance company, and Medicare will not.
Hospitals like Virginia's Sentara Obici constantly look to reduce the risk. For example, after disinfecting rooms, advanced technology helps ensure they got rid of the bacteria by swabbing the area just cleaned, then inserting the swab into this reader that analyzes the surface.
Anything less than 250 is a pass. Anything over 250 is a fail. My team will come back and re-clean the surface if it failed.
Another disinfection practice involves bathing the room with ultraviolet C light, which studies show can reduce the transmission of 4 superbugs, MRSA, C. diff, Staph aureus, and Acinetobacter by 1/3. Believe it or not, some hospitals now use copper to help fight infections on hard surfaces like this copper-infused overbed table, and even in linens like these bed sheets that have copper woven into them.
Copper just has natural antibacterial properties to it, so it helps kill any bacteria on site.
Opportunities to detect infections.
Healthcare workers understand the sooner a device is removed, the lower the risk of infection. So they evaluate each patient to determine whether that can be the day their device can be safely taken out. They also closely watch patients for symptoms of an infection, like fever or diarrhea, and whether they need testing. While hospitals and other healthcare settings are taking steps to minimize the risk of infection, there's actually a lot patients and their families can do too, both ahead of time and during the stay. The healthier a patient is before entering the hospital, the lower their risk. Experts say a big part of overall good health involves a robust gut microbiome. That means having good bacteria in the body, which can often fight off the bad bugs encountered at the hospital, especially those resistant to antibiotics like C. diff. Patients are advised to ask their doctor whether antibiotics are truly needed because these drugs tend to kill all bacteria, including the good.
C. diff is in all of us naturally, and if they're taking antibiotics that are not needed, it's going to kill the flora that's in your stomach that helps prevent C. diff from kind of going crazy.
Armando's experience with hospital infections motivates him to help others.
Ask a lot of questions. Don't be afraid to ask a question, and certainly don't be afraid to ask the healthcare workers to wash their hands. It is the most important single component in the delivery of care: hand hygiene, hand sanitizing.
Yes, clean hands. As simple as it sounds, it can also prevent visitors from spreading disease.
We touch our face so many times. We don't know what surfaces we've touched.
Some hospitals have lower infection rates than others, so do your research, and if you have a choice, talk to your doctor about which facility is best for you, or consult Hospital Compare on the Medicare website. Lorie Johnson, CBN News.
Thank you, Lorie and Centera, for all that very valuable information. And doesn't it make you grateful for the hospital staff that work so hard to protect us and help us? You know, housekeeping, nurses, doctors, all the medical staff. We value their efforts to help us, but there's some things we need to do too. I'm so glad Lorie brought up, if you're sick, if you're ill, don't go visit somebody. Wash your hands. There are some practical steps we can take. So, Lorie, thank you so much for that report.